already have hypertension and I have high cholesterol. So as my doctor said, now you're under the triple threat. You're literally a walking time bomb. You become so angry that you have allowed yourself to get this disease. So it's like, I'm not getting up every day, sticking my finger, checking no blood sugars, and I'm not taking all that medicine, putting all that stuff in my body. It was like, I'm gonna beat this another way, and it was not working out for me because my blood sugars continued to rise. So I'm sitting at my desk, get this email, hey, got this new program, want to do a trial, it's called Will Smith. They want to help you get your diabetes under control. What have I got to lose? Best decision I ever made.
So the two secrets of Wellsmith are engagement and activation. Well, you walk down the streets of North Carolina and you realize that lifestyle choices have a lot to do with disease. What we do in Wellsmith is we put that digital health platform on your smartphone, and that allows us to be with you every day, wherever you are.
Because it's just little things that can help your day-to-day living.
You start to realize that, hey, if I'm following the diet, if I'm making the right choices, I'm seeing my weight come down, I'm seeing my blood pressure change, I'm seeing my blood glucoses improve, and I'm communicating with a care team that helps me to understand my choices.
And then you can look over a longer period of time to be able to identify trends proactively.
One of my care team people is Nurse Janet, and she is so awesome. She's always looking at my numbers. She'll occasionally send me a message through the app saying, hey, I noticed your numbers have been really great. Keep up the good work. Just that little attaboy. That just makes all the difference.
If we can devise programs which engage people to do the right thing for their health and help them to understand that this is making them feel better and be healthier, then we can turn around that cycle.
The elephant in the room is the cost of healthcare. The intersection of cost, service, and price, and that's value. Meaning, what am I buying? Am I going to pay less for the same thing, or am I going to pay less because I don't need, I don't have that disease progression? And that's what we're encouraging. That's true value, is not to have the service at all, to avoid the service. And that's where we save money in terms of reduced visits to the ED, reduced visits to the physician, reduced pharmaceutical costs.
I believe the Wellsmith program allows us to be proactive, engaged ongoingly with people in the community to help enable them to manage their own health and well-being, to stay out of the hospitals, to stay healthy, and to stay more functional, contributing members of society.
I'm a person that I need to be accountable, or I'm gonna run amok. This is a way, hopefully, for me to get control before it gets out of hand.